The Cannabis Nurse Experience, Spirituality as the Root of Cannabis Care. This presentation will gently explore how cannabis was used in the past for spiritual practices and how we are coming full circle with these practices to help us work with patients who are vulnerable and fragile. We will explore case studies on how working with the spiritual principles in cannabis has brought hope and inspiration for growth and healing to the patients who seek a better quality of life.
My name's Mark Worcester. I am a candidate at the University of Maryland School of Pharmacy, Master's in Cannabis Science and Therapeutics program. I am a registered nurse, and I am absolutely AFA. I'm a co-founder of the Green Nurse with my partner, Sherry Tutkus. I have no conflict of interest noted. I am a cannabis patient, an advocate, and an activist.
Hi, everyone. My name is Sherry Tutkus. I'm a registered nurse with my bachelor's in science and nursing. I am the co-founder of the Green Nurse. There is no conflict of interest. I am a cannabis nurse consultant, mentor, cannabis patient, advocate, and activist. So spirituality is the root of cannabis care. This is Sister Suzanne, who has been working with cannabis care nurses for the past 3 years. She has an extraordinary story that we're going to show in the next slide and a little video presentation where she shares her experience of cannabis, spirituality, and religion.
My name is Suzanne Carroll, and I am a cannabis user. I am also a former sister of St. Joseph. I entered the convent a year after I graduated from high school, and I stayed in the convent for 5.5 years. And then I finally determined that that was not the path that God had chosen for me. So I left the convent and went back to secular life. It doesn't mean that I left my love of the church or my love of Christ. I took those with me and have been trying since then to use them for the good of other people. When I began using cannabis or began interacting with the cannabis nurses, I was at the point where I was actually losing hope, which is not who I ever was. But my pain had gotten to the point where I did not feel that I could participate fully in life at that point. But when I started to work with the cannabis nurses, that hope was rekindled. As I said, I was beginning to lose hope. And once I interacted with the cannabis nurses and finally began to be able to relieve some of my pain through the information and the product that they shared with me, I truly believe that I was then encouraged to reinvest myself in my sharing of my love of Christ with others around me. Cannabis helped me to grow because, as I said, when I started to lose hope, I was in a stagnant position. I didn't feel like I could make any forward progress despite the fact that I was involved with the medical community and they were doing everything that they could to relieve my pain and suffering. But finally, through my interaction with the cannabis nurses and my use of cannabis, I actually felt like I had gotten to the point where I could participate fully in the life of Christ. Cannabis has brought healing to me by relieving the intense physical pain that I felt constantly. It has allowed me to grow emotionally to the point where I could, as I said, start to give back some of the things that I had that I felt Christ had prepared me to give to people around me. Cannabis, religion, and spirituality actually, for me, all form a cohesive whole. I am reminded that if we have faith, then we are prompted to pray. The important thing that I would like to point out is that prayer involves conversation with Christ. And when you talk to somebody, it's extremely important to listen for an answer. And that's one of the things that many of us forget when we are praying. We forget that we're actually talking to a person, and therefore we would expect some sort of response. The problem is the response we are usually looking for is, okay, I'll do what you want me to do. We need to remember that that's not always the answer that we get. will either get that for an answer, or no, I have something else in plan for you, or you know what, you just have to wait. It's not time yet, because healing comes in Christ allows us to suffer for some reason, and therefore healing comes from him, but it comes from him in his own time, not in our time. So we have to be patient and let him respond to our prayers in the way that he sees fit. When I'm dealing with the cannabis nurses, they often ask me, what would Jesus say? And I know exactly what he would say. He would say that marijuana is a plant that he gave us for a reason. And unfortunately, it has a stigma associated with it, because some people have abused that plant. But we do have to remember that he gave it to us for a reason, and therefore he would expect us to use it appropriately. I gave permission to the cannabis nurses to interview me and tape it, record it.
Our objectives are that the learner will consider spirituality as the root of cannabis care, consider the holistic role of the nurse when providing cannabis care, understand transpersonal nursing theory and how it applies to the patients we care for and the providers we work with, and consider how cannabis care brings hope and inspiration for growth and healing to all of our communities and the people we care for. The bottom line is the learner will see the importance of bringing hope and inspiration for growth and healing to our patients by connecting with the patient's spirit first, to meet them where they are on their journey. So the NCSBN has a call to action that was published in 2018. And they say that the nurse must have 6 essential areas of clinical knowledge. They have to understand the state laws for both medical and recreational, principles of the marijuana medical programs, understanding of the ECS, the receptors, cannabinoids, and interactions, pharmacology and associated research, safety considerations, and risk-benefit ratio. And the nurse shall approach patient without judgment regarding their preferred treatment.
That to me is probably the most important statement of the NCSBN. The nurse shall approach the patient without judgment regarding their preferred treatment. So judgment in the dictionary is to make a decision or form an opinion. So if you think about it, the mind is the judging machine, good, bad, neutral. And if you think about it, judgment stems from ego, non-judgment stems from spirit. So truly, there is no room for ego and judgment when we're caring for patients. So this is an opportunity for you all to consider spirituality is the root of cannabis care. And we will break that down even further in the following slides with some examples.
Namaste. So in the yogic tradition, in the Indian tradition, there is a saying, Namaste. And it really is, it just means I bow to you, or I bow to the light in you. And it's over 2,500 years. People have advised to be restrained from judging others. Sick and suffering patients and the clinicians that we work with care about how you make them feel. How do we want to make our patients feel? How are you tapping into a patient's spiritual world for connection and understanding without judgment to bring them hope? Here's what a few of these prophets and sages have had to say. Love is the absence of judgment, the Dalai Lama. If you judge people, you have no time to love them, Mother Teresa. Thinking is difficult. That is why most people judge, Carl Jung. And do not be the judge of people. Do not make assumptions about others. A person is destroyed by holding judgment about others, Buddha. There is not room for judgment when caring for any patient and when we're working with other providers. So the history of cannabis. Cannabis has been used for both recreational and medical purposes for several centuries. Hashish, which is a form of cannabis, was found in Egyptian mummies. So let's explore spirituality as the root of cannabis care. Spirituality is defined as the quality of being concerned with the human spirit or soul as opposed to material or physical things. Entheogen is a psychoactive substance that includes alterations in perception, mood, consciousness, cognition, or behavior for the purposes of engendering spiritual development in sacred texts. Cannabis has served as an entheogen dated back as far as 2000 BC in these cultures: India, China, Asia, Africa, German paganism in the Middle East, and multiple other indigenous tribes throughout the world. It's been used in shamanic and pagan cultures to ponder religious and philosophical subjects. Exploration of the human mind and subconscious for enlightenment, and used as aphrodisiacs during rituals and orgies.
Spirituality as the root of cannabis care. Let's explore that just a little bit further. So, root, when we think about the root is defined as the part of the plant that attaches to the ground, typically underground to support, delivering water and nourishment to the rest of the plant via numerous branches and fibers. Another definition of root is the basic cause, source, or origin of something, the essential core, the heart. So I'm going to bring in another couple of Sanskrit words. Chakra, as we talk about anandamine, is the Sanskrit word, ananda for bliss. Chakra is the Sanskrit word for wheel or life force center. So we need to remember that anandamine is taken from the Sanskrit word bliss. So the Sanskrit vortex energy life force center is the center of consciousness that controls mental, emotional, and spiritual well-being. It's described as a wheel of light or our life force energy. So each chakra is connected to spiritual principles, and there's 7 main ones. So how does this all fit together? Well, think about it. Roots nourish the plant from below. We have the root chakra that is connected to the feminine, right? The first chakra is between our legs. It's connected to the earth. It maintains our life force energy and grounds the soul into the physical realm. The sun nourishes the plant from above. We have the crown chakra, which is connected to the masculine. The 7th chakra is connected to the spiritual realm and receives energy, light, and information. People with fully developed crown chakras have been known to have more control over their mental and emotional bodies. So spirituality is the root of cannabis care. As above, so below. One of the universal laws is the law of correspondence, which expresses the idea that there is always harmony and correspondence between the several planes of existence: physical, mental, and spiritual planes. We, as practitioners, must consider how to nourish our patients' mind, body, and spirit when working with them. Energy healing and other types of alternative healing modalities have the capability to support a person's spirit for the healing trajectory, including the total spirit, mind, and body. Cannabis nurse experience. How do we work with a patient's spirit? Well, number one, we master our ego. We quiet our ego. We remember the 6 National Council State Boards of Nursing to not judge a patient. We don't make it about us. We have compassion. We connect. We allow the presence to be there with our patients. We ask them, what is important to you and how do you want to live your life? And how do we get there? Well, we think high thoughts. Hope and inspiration for growth and healing. This is probably one of my favorite slides because it's truly about changing the language and the dynamic around what it means to be high. What is healing to you and what does this look like? Really, really important. So if you think about the traditional system as clinicians, we usually start with disease and symptoms. Biopsychosocial, spiritual aspects of healing is truly important. So we work with symptoms, we work with body parts, we work with diseases. If we're lucky, we get to the mental, emotional, psychological state of the patient, but rarely do we ever get to the spiritual healing. So what if we did it backwards? What if we started to work with the patient's spirit first to see what would happen? So hope, that spiritual connection, that radiant compassion and empathy, bringing feeling and a desire for a certain thing to happen. You heard Sister Suzanne say that it brought her hope. Inspiration is being in spirit, that mental, emotional connection that allows us to be stimulated to do something creative. Being in spirit. Growth, growing in health, the mind, the body, and spirit, transforming, self-development, personal development, self-guided improvement, self-help through guidance. And healing. Healing is the process of making or becoming sound or healthy again, to restore to sound health, and it's subjective for every patient. So spiritual healing, mental, emotional healing, physical healing. And as I've said many times before to my patients, is healing is not the absence of illness or disease, but it's doing the best you can with what you have right here, right now, to live your best life.
So the ACNA scope and standards mentions human caring right in the document. Cannabis nursing is both a learned skill and a practiced art. The cannabis nurse builds upon expertise from previous experiences with healing in nursing while enacting reflective practices to support growth toward expertise. Human caring. It's the guiding moral ideal of nursing. Human attempt to connect with others in order to protect, enhance, and preserve human dignity and humanity with integrity as one supports a person toward finding meaning in illness, suffering, pain, and existence. Other important scope issues in regards to scope, just to remind clinicians, do not give medical advice and cover your ass. Remember, according to the FDA, only FDA approved medicines can make claims to cure, treat, or prevent a disease.
Watson's human caring theory. Caring is the essence of nursing. Jean Watson. So when I hear nursing theory, my spirit freezes because generally it's so abstract. However, this truly makes sense to me. This concept was first introduced to me by Dr. Carrie Clark, Watson's human caring theory, and she wrote about it in the nursing program in Maine. And like I said, it totally makes sense. So I'm going to hope to break it down for you all. So this theory is part of how I work with both patients and clinicians that I educate. So Jean Watson is an American nurse theorist and nursing professor who is best known for her theory of human caring. Watson's human caring theory is based on 3 different principles of psychology. Humanistic psychology, which calls for the person to look deeply within with the knowledge that self-awareness is the prerequisite for self-growth. Eastern philosophy, which is spiritual principles looking at the whole instead of the parts and focuses on the similarities. And then transpersonal psychology is spiritual psychology, whole person psychology, connecting with the spirit, transcending self and ego.
So in the Cannabis Health Index, Dr. Hugh Bleshing talks about transpersonal psychology as both an art and science of mind-body medicine, and emphasizes self-responsibility for problem discovery, self-guided treatments, mindfulness, meditation, prayer, spiritual practices, self-actualization and connection to deeper part of self or consciousness for healing. So Watson's theory of human caring, transpersonal nursing. Watson describes a transpersonal nurse as one who has the ability to center consciousness and intentionality on caring, healing, and wholeness, rather than on disease, illness, and pathology. Transpersonal caring focuses on helping patients achieve a more complete sense of harmony within the mind, body, and spirit through the use of caring transactions. In Clark's Cannabis, a handbook for nurses, being released on Amazon in January 2021, Dr. Clark aligns in her chapter with Watson's 10 Caritas processes as she paired this with the art of cannabis care nursing. So what are the Caritas processes? Jean Watson, founder and director of the Watson Caring Science Institute and professor of Colorado's Denver College of Nursing, developed the 10 Caritas processes. The 10 processes reminds us to remember that our focus is human caring, not curing, but caring. There are 10 processes. In next slides, we will give you specific examples of what this may look like.
So out of the 10 processes, each slide we're going to cover 2. So this slide here, I want you to all consider, how do we practice loving kindness and compassion towards ourselves and others when we're working with patients? But we connect with the spirit and we educate through loving presence. We provide the same loving care to ourselves as we do our patients. We are the change. We become the change. We are the power of example as to how we nourish our endocannabinoid system. And we share from that perspective as well. And we demonstrate this love not only to the patients we care for, but also the professionals and our colleagues that we work with. The second one that I'd like to address is, how do we remain authentically present, honoring our own inner life and that of others? We want to see everyone as unique and special, including ourselves. We want to respect that we're all on our own journey and that there is no room for judgment. We provide personalized individual care and meet patients where they're at, and with respect to where patients are on their journey without that judgment.
So how do we remain sensitive to self and others? By cultivating our own spiritual practices to move beyond ego self into higher levels of consciousness for healing. Spiritual practices are different than religious practices, but can incorporate both, as the nun said. And spiritual practices may look like mindfulness, meditation, yoga, chanting, rituals, walking in nature, affirmations, reading spiritual materials, so many things. Yoga is a practice where we connect to all parts of ourselves, the mindfulness, movement, meditation, and breath work. It can be a very spiritual practice. And these practices pair very well with cannabis as a tool to evolve our spiritual practices. And as we deepen our own self-awareness, we can share that with others. So how do we develop and sustain a helping, trusting, and authentic, caring relationship? We must ask ourselves these questions. How may I best serve this patient and do it where they are on their journey without judgment? Can I care for this patient as I would a loved one? And how can my authentic self come forth without ego or attachment?
Creating a healing environment at all levels. So how do we create a healing environment on all levels? Well, we hold space. So when you're holding space for a patient, that means treating yourself, your patients, and your colleagues with care, kindness, compassion, and love as you educate on the most misunderstood plant in the world. Wherever you go, there you are. You carry your energy with you into your healing environment. So you really must be conscious of what your own energy feels like. The healing environment can be anywhere, and it starts with your connection to your own spirit first as you connect with your patient's spirit. We become the place of healing wherever we are, whether it be a hospital, an office, a home, a dispensary, on the phone, on a video chat. We are the healing space. Cannabis care and our ability to teach can be anywhere, any place. Our healing environment is staged by the energy we bring into the consultation when we first connect with that patient. How do we remain present and supportive to both positive and negative expression of feelings within yourself and with the patients you work for? Well, what we do is we authentically listen to a patient's story without getting caught up in the drama. So truly being silent and listening to what they have to say. Tapping into our own spiritual wisdom to help us to listen more. Listen to understand, not to reply. And with the right dialogue, the patient will tell you exactly what they need.
How do we engage in transpersonal teaching and learning within the context of caring relationships, staying within others from others' frame of reference? Well, motivational interviewing and coaching, providing teaching tools that are appropriate for them, handouts, video, experiential learning, providing unbiased education through research and substantiation of resources, meeting them where they are, providing education, answering questions, and allowing them to make the decisions. How do we provide creative problem solving or solution seeking through the caring process? As nurses, we seek out what patients need and we bring it to them through education. We engage with the patient and encourage participation in seeking solutions through a shared decision model. We're expert motivational interviewers, asking critical questions and directing the conversation to empower a patient to make a decision. We use solution seeking through trial and success, coaching, and truly empowering patients' mastery over self and the limits that patients often put on themselves.
Assisting with basic needs as sacred acts. So how do we assist patients with these types of things? How do we work with patients and their human dignity? How do we sustain that? How do we honor the spiritual nature of those that we care for? Well, number one, we humble ourselves. Number two, acts of service, very simple acts of service, simple tasks, random acts of kindness. And I'm just going to give you a couple of examples. So a hospice patient that I once took care of went into the home and just sat with him while he took his first dose of RSO, just to make sure that he was comfortable and safe. So being there, doing the education, but just giving the extra time just to make sure he felt comfortable being in his own skin, having that first dose. Here's another example, hospice patient teaching them on inhalation. So there was a Chinese patient that I was working with, had stage 4 cancer. He could not get anything in. He needed to inhale in order for him to get in either the capsule, the gummy, the tincture, the chocolate. He couldn't get anything in, but he was petrified. And so we had an experiential visit where I taught the daughter how to roll, and the daughter and the patient, who was Chinese speaking, I sat there and helped them, coach them through lighting the first joint, coach them through taking that first inhale, making it okay, being present and making them feel safe and decreasing the stigma around using something that was so foreign to him. And here's another quick example too. You know, some of the elderly folks that we work with have a difficult time online, have a difficult time filling out forms. So taking that time to assist them, even with the intake form, that's kind, right? And then there's other times too that I've worked with patients that have come in and we've had topicals. And so giving them, rubbing a topical on their knee, you know, rubbing a little topical on their ankle as you educate. So giving them that little extra touch. I know in COVID-19, things are different, but these are some typical examples of some of the things that we have done in our practice that have helped many patients. Okay, so how do we remain open to spirit, the mystery and the unknowns to allow for miracles? This is probably one of my other favorites. So truly, what is a miracle? A miracle to me is a change of perception, that aha moment when it just makes sense. So when we're open to having our own mystical experiences, we allow patients, we give them permission to be open. We are eliminating the box that says we must think outside the box. So as clinicians, we must be the seeker of wisdom through our own experiential learning and trying new things. Reconnect to your divine self, the indwelling spirit, to bring in a new way of working with all people. Believe your patients, believe your colleagues. It's their experience and their perception. I believe that you believe, and I support you with love and compassion.
So what are we seeing as cannabis nurses? Desperate, vulnerable patients that want a better quality of life. And it spans the ages. It's pediatrics to geriatrics, truly everyone. And in multiple settings, in the office, home, via telephone, video conferencing, doctor's offices, dispensaries, and hospital settings. Patients seek education about cannabis for the following reasons. really the number one or highest is creating a better quality of life, right? But they want to bridge the gap, a combo of cannabinoids and pharmaceuticals. They want to decrease the side effects of the other pharmaceuticals, i.e. chemo. They want to come off pharma altogether, weaning off pharmaceuticals and other substances. They're acquiring information on cannabis before turning to pharmaceuticals. They're wanting education on how to use cannabinoids as a health and wellness tool. Athletes, for instance, they're wanting education on how to have a safe recreational experience. And, you know, really, a lot of folks are coming just as a last resort because nothing else has worked and they're losing hope.
Choices, 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 truly. But do we really, really, as clinicians, allow our patients to choose? Do we take the time to connect with the patient to help them understand the choices that they have? Do we take the time to ask our patients, what is important to you and how do you want to live your life? So pharmaceuticals, does the all pharmaceutical approach support the endocannabinoid system? We need to look at that. So pharmaceuticals is a standard of care. And so what is truly wrong with the all pharma approach? Well, obviously, we all know side effects, adverse effects, allergies, black box warnings, drug nutrient depletion, drug to drug interactions. So we must ask ourselves, are these pharmaceuticals, do they support and nourish the endocannabinoid system or not? And if they don't, how are you educating your patients on that? So what is missing from the all pharma approach? Well, endocannabinoid system care and those activities that support and nourish the endocannabinoid system. Cannabinoid therapeutics is a new way to manage health. The issue that a lot of people have with cannabinoid therapeutics is that they associate cannabinoid therapeutics with just cannabis. So as we all know, it's much more than just cannabis because we have an endocannabinoid system that is affected by all of the choices that we make. We're either supporting the endocannabinoid system or we're not, and we teach that. So cannabinoids actually add another layer of healing as many patients open up to their consciousness, to spirituality and other alternative complementary modalities for healing. So I truly see that both cannabinoids and pharmaceuticals, the combination is the way of the future. Truly, patient empowerment is the way of the future. Starting with that connection to spirit to bring the hope and inspiration for growth and healing. Endocannabinoid system, personal care, Canna wellness, focusing on all of the tools that support and nourish it, combining plant and traditional pharmaceuticals for complementary personalized care. Patients have a lot of fear. There's a huge disconnect between health and care, creating trauma for patients. I've seen a lot of patients that have, experienced medical neglect, medical and pharmaceutical trauma. It is completely real. They're filled with fear, fear of stigma, fear of not being heard, fear of being labeled cannabis use disorder, fear of abandonment, and fear of seeking traditional care while using the plant. So when I've asked my patients about talking to their doctors about cannabis or their clinicians, they have said the following: he or she doesn't believe in it, they won't prescribe it, doesn't think it's a good idea, said go for it, but I can't help you with it, said there's not enough studies on it. And one parent said to me, my child's too young to try it. So if we all had endocannabinoid system knowledge when patients said the following statement, this might change the trajectory of care. So when patients come to me and they say, I've tried everything and nothing works, they don't know what's wrong with me. They think I'm crazy and it's all stress. I'm sensitive to all medications. Traditional pharma doesn't work for me. So what I truly do is that opens up my eyes to look at other things. I think endocannabinoid system deficiency. And then we work with patients' spirit to make them feel okay being where they're at. And we continue the education. So how do we address this fear? We connect with their spirit. We meet them where they are. We will hold your hand until you're ready to let go. So this is a case study. This is the first patient that I worked with. This can be a really long-winded slide, so I'm going to try to get through it kind of fast. So this is a woman who is a 46-year-old female, nurse, single mother of 3, healthy, we had a past medical history of migraines, hint, hint, ADHD, hint, hint, polycystic ovarian disease. So just think of these things. She was fully functional, doing well, managing these with traditional pharma, high functioning. And she ended up taking a hit at work. She got a very, very bad intestinal bacterial infection, pseudomembranous C. diff colitis from work exposure, ended up in the intensive care unit, severe gastritis, nausea, vomiting, diarrhea, chronic abdominal pain, anorexia. Her mental health suffered. She developed an autoimmune condition shortly after that, polymyalgia rheumatica, the myofascial chronic pain disorder. Mental health started to suffer, had depression, anxiety, insomnia, panic attacks, agoraphobia, was later diagnosed with PTSD, and failure to thrive at the age of 48 years old. That's depressing. And then she developed passive suicidal ideation. It's not that she wanted to die, but she wanted the pain to go away. The thing that's very interesting about this woman's case is that not only did she did all of the traditional therapies, but she also engaged in all of the complementary therapies that support and nourish the endocannabinoid system. So really quickly, we'll go over what she did. She took all the pharmaceuticals that the doctor told her to take. At one point, she was on over 18 medications in various combinations, including IV antibiotics, oral antibiotics, antidepressants, anticonvulsants, benzodiazepines, beta blockers, opioids, narcotics, nonsteroidals, steroids, tricyclics, the tryptoline family she went through, multiple supplements, probiotics, patches, creams, and gels. She did the surgery. She had surgery on multiple meds, saw a pain clinic, had a cognitive behavioral therapist, a psychiatrist. She wanted to get well. She also did acupuncture, chiropractic care, essential oils, aromatherapy, energy work. She saw a shaman. You know, she was in too much pain to hit massage. Yoga, couldn't get on the floor. Saw a nutritionist. Her diet was horrible. And basically she was sick and she was suffering. So nothing worked. She was circling the drain of despair. She had the passive suicidality. And what ended up happening was an older nurse colleague came to her home, brought a cannabis joint to her home, and basically told her to get with the program. You know, get with the program. Cannabis has been legal in Massachusetts since 2012 for medical, 2000, and this was at the end of 2014. So basically she used the cannabis. It bridged the gap. She was able to come off of pharmaceuticals using plant medicine and other tools. So she truly had a transpersonal nursing experience. And in this next slide, I'm going to get into what that looked like. So the woman in the middle, her name is Mary Ann. And basically, if some of you have heard my story before, but this was actually me. I was that nurse. And so this is Mary Ann. She was one of my clients. I'm a Reiki practitioner and a reconnective healing practitioner. And she was one of my clients. And she had been trying to get in touch with me when I was sick and ill. So she came to my house with the cannabis joint and she connected with me. She really, truly connected with me with conscious intent. She shared her story with me. She came out of the closet with her own cannabis use and let me know that she had been using cannabis since she was 17 years old. I've been using cannabis since I was 17, Sherry, she says. I'm not on any medications ongoing and I've never been hospitalized. I had to look at that. You know, she came to my home. She gave me permission to smoke. You know, she helped me to bridge the gap. I was able to come off of pharmaceuticals using plant medicine and other tools. Everything that didn't work started to work again. So truly, this was my experience with this nurse. The first thing that she brought me was hope, right? So cannabis nursing is transpersonal nursing. It's patient-centric, patient-focused. As cannabis nurses, we're looking through the lens of a patient and a clinician, both. Our consciousness is focused on healing and wholeness rather than disease and illness. Like I said, healing is not about the absence of illness or disease, but empowering patients to make informed decisions to support their endocannabinoid system for symptom relief, to do and live their best. Truly, truly, the most important thing you can ask your patient is what is important to them and how do they want to live their life? And also try to remember that patients truly, truly care about how you make them feel. The essence of nursing is human caring.
So the next case that we'll talk about was a 48-year-old female, and she was suffering from a long period of ulcerative colitis. Also suffered from migraines as well, hint, hint, for a very long time. And she was in a full flare-up. She had been in remission for a period of time, using the traditional Remicade medication, but she was in a full flare-up, and she had failed her second biologic, which are some new medications that were on the market. She was part of a trial, and it did not work. And she was at the end of her rope. She really had lost hope. She was truly suffering. And it became a relationship of trust. It was a transpersonal nursing experience. She trusted, she had not used cannabis in the past. And so in working with this particular patient, I was able to connect her with another patient who had similarly suffered from ulcerative colitis for a very long time and who had been absolutely against cannabis for a very long time, but she had had a positive experience within the last year, and it alleviated this particular patient's fears surrounding it. And within a 30-day time frame, she was able to go from lost hope to excited about life. It changed, literally changed the course of her life in a 30-day period. It was an amazing, amazing story.
Love that.
So listen, things are not the answer. You are the answer. You are the answer.
Yes. Okay. Here's another one of our last case studies. This is my mother. Those of you that have heard my story, when I first started using cannabis, she was anti-cannabis, very strict Irish Catholic. She blocked me on Facebook and wrote me out of her will. However, when she saw the nun's video from 2.5 years ago, it opened up her mind and her perception. She was able to have that connection with the nun through the video. Stigma was her number one resistant, and that was related to fear. So the nun got my mom on the cannabis. My mom and I had this transpersonal connection after I sent the nun's video to her. And basically, how did we work with her? I met her where she was at, right? I started off the safe way. What's the safe way? 2 ingredients, MCT oil and CBD isolate. And then from there, we worked together. I met her where she was at. I listened to her. I didn't push her. She asked questions. I provided answer, and she made the choice. And here we go. This is my mom.
Da, 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 da.
Hey everybody, it's Sherry Tuckus from Green Nurse, Living Your Best Life, and I'm here with my mother. Hi, Mamacita.
Hello, my darling daughter.
Just a quick question.
Sure.
How is cannabis oil helping you live your best life?
Oh, by making me virtually pain-free. I'm not saying that every single bit of pain is gone, but I can function now. I couldn't function before. I couldn't move. It was so painful to move. And yet it was so painful to lie in the same still position, to sit. I mean, I had to keep rotating things around. And it's just going to be freedom. Freedom from pain, freedom from feeling depressed about the pain.
So cannabis
Living
is
my
giving
best-
you freedom
Yes,
to live your best life.
exactly.
Mom,
Exactly.
I love you.
I love you too, Sherry.
Remember, it's about living your best life.
So the part that's really cool about this story with my mother,
Whoop,
Tuckus from Green Nurse.
whoop.
so the part that's really fun about this story with her was that when she started to feel good and she got really excited, she'd say, I feel so good and I'm not high. And I was like, that word high, that's why we're changing it. Hope, inspiration, growth, and healing. Truly, truly, truly changing language, because language is so important with how we're working with patients. So heal the spirit equals a healthy spirit, right? So I kind of broke it down a little bit as to how I got to healthy spirit. Healing is a generic term which covers an acts of intervention via medicine, cure, and transformation. Spirituality is the root of cannabis care to heal the spirit, which starts the process of spiritual connection for healing the mental, emotional, and physical body. As I've said before, healing isn't the absence of illness or disease, but doing the best you can with what you have right here, right now, to reach your goals, to live your best life.
So here we are, total healthcare, THC.
Biopsychosocial spiritual care. I would like to invite you to consider to start working with your patient's spirit first. Make it patient focused. Ask your patient the question, what's important to you and how do you want to live your life? And then you're going to do a personalized approach to cannabis care, and you're going to truly empower your patient, healing the spirit through love, kindness, compassion, empathy, to bring that hope and inspiration for growth and healing.
Cannabinoid therapeutics. So cannabis is one tool. We need to educate on all the other tools that support and nourish the ECS. Now, cannabis is an important tool in that it allows the patient to begin to participate in life in all of those other activities, like exercise, like being present with family. So it is a tool that we use. And you know what? It's about living your best life and helping others to do the same.
Okay, everyone, now we are ready for live questions.
Here we go.